Hello and welcome to another episode of Meet the Expert on the Block. If you're out there, be sure to let us know. Give us some thumbs up. My name is Dawn Black. I'm the host of your show and I have our special guests here, and I will be introducing them in a little bit, but I always like to do some housekeeping. Got to get that housekeeping done. And what I'm saying is that if you're out there and you're seeing this, give us some thumbs up, give us some hearts. Definitely want to know if you love it. And if you like what you see and the information that I'm providing, be sure to follow Dawn Black Realtor. I'm out there and I'm streaming live. Just to let you know, we're streaming on my personal page, business page, neighborhood pages, LinkedIn, YouTube, X, Facebook, Instagram. I even have our guests streaming this on their pages. So we're really trying to get the word out about these people, about these businesses and what they do and how they do it and why they're doing it and what were they doing before they were doing it. So I would love to introduce the business is New Beginnings Chiropractic Wellness Center, and the owner, I would like to introduce her, is Dr. Kimberly Gibas. Kimberly, thank you so much, Dr. Kimberly. Thank you so much for joining us, and her assistant, Pierce, who we have had on our show before. But now we're going to be talking about a little bit different. So what I would like, you guys decide who wants to talk. I would love if you would introduce yourselves and let us know how people can get in touch with you.
All right. I am. I was here for the run through, so I'm going to speak first.
Okay.
I'm Dr. Kennedi Pierce. I have graduated chiropractic school back in August of 2023. So I'm a little bit fresh out of school, a little bit more of a newbie to this world as a physician. However, I've been working with and for my aunt for many, many years now. So being in this space is not too new for myself, but I will let my aunt introduce who she is, and then we'll share our contact information as well.
Great. Hi there. I'm Dr. Kimberly Gibas, and I have been in practice since 1997. So
wow,
quite a few years now, which I'm so excited that Kennedy has decided to on board so she can kind of take some of the stress off me. But our location is 33 West Higgins, South Barrington. We are located directly across the street from the Gobert's Pumpkin Farm, and we've been here since 2005. So.
Oh, yeah.
Wow. Phone number is scrolling at the bottom, as well as the website and our email. But phone number is 847-426-7008. And then the website is www.dr, like doctor, drgibas, GIBAS.com. And the website's slightly outdated, but it has all of the relevant information needed on
We're working
there.
on it.
You're to be continued.
Yeah.
Oh, well, so thank you so much for doing that. And again, thank you both of you for deciding to come on together. I think this is going to be a real treat. So what I would love to hear is, first off, I want everybody has what they were doing beforehand, before they actually got into what they're doing now. And if you wouldn't mind sharing that with us, both of you, I'd love to hear both of your little stories about how you got so involved in what you're doing now. Who wants to go first?
Yeah, I'll go. So basically I've been in school for a really long time prior to obviously becoming a chiropractor. But originally I had graduated high school and went on to try to be an accountant. And when I took one class in accounting and said, absolutely not going to work for me. So fortunately, I was able to talk to one of my teachers and kind of just navigate some of those life things that you're trying to, figure out what you're going to do for the rest of your life. And, it was one of my science teachers, and he said, you're really good at science. Maybe you should go into something in that field. And from that time, I just started figuring out, I'm going to go into the medical field. And then I would come home from college and stuff and start working with the chiropractor that, kind of motivated me to go into the chiropractic world. And so, that's really from that point on, I was in school for almost 8 years. So, and then from there, graduated and started working for that clinic for 7 years. So
you've been doing it for a while there.
yes, yeah.
I always tease my aunt, but I've been very grateful that I grew up right down the road from her practice, and so I always tease her that she's used me as cheap labor. Because even before there was like computer systems, everything was online. There used to be files, and me at 12 years old would come in here and file everything. I remember there were a few times I'd give patients like tours around the office.
Oh, cool.
So she utilized me in any way that she could. So I've been in this environment since a very young age. At this point, more than half my life actually. So that's kind of that's what really drew me into this. And then I always I really loved the aspect of being able to be in healthcare and really work in a mind, body, spirit type of environment, and really like live out what I am doing and teaching. So yeah.
Well, that is that, and you know what, too, your jobs, both of you, I mean, it has to be rewarding. You get to see somebody come in and with like an injury or just with an issue, and then you're there hands-on helping them heal them so that they can live a more easygoing, healthier life. I mean, how rewarding is that? So can you tell us a little bit about? I'd like to hear, your business as a whole. So how many people are staffed at your business right now? How big is it, I should say?
Yeah. So there's Dr. Pierce and I are here as the doctors, and then we have a couple of massage therapists, and we have a couple of girls that kind of fill in, if the girls are, on vacation or, needing some time off, we have a couple of girls that fill in. But right now that is it. And then I don't know.
Costa.
Dr. Costa is our naturopathic doc that works here a couple days a week. And she's our naturopathic doc that helps more of navigating people with, dietary issues, with blood panels that come back that are not in a good way. She can help them get on a good nutritional regimen. And yeah, so that's all that's here.
Wow. That's enough. I mean, so I was going to ask you, so when somebody calls up, what is the first thing that happens? I mean, so what is like I want to say the patient experience or the customer experience when they first give your office a call?
Yeah. Okay, I can go.
Yeah.
What I like to say is when obviously the patient calls in and the goal is to, hopefully get them to, make sure they know where we're at and things like that. When they come in the office, the main thing is that, we try to, give them that office tour experience where they kind of know where everything is. They hopefully have had the chance to fill out their paperwork. I think this has been a big shift for me because when I was starting, as Kennedy was saying, we had all these files and now everything is done electronically, and it has helped people be able to do their paperwork in their own home or at work or when they're on their way driving, and hopefully they're not doing that. So please don't, you're on your way here. But so they, have their paperwork done, and then we just basically, if they have insurance and ID, we'll take that. And then we will take them into the consultation room and just try to collect as much information as we can in order to be able to develop a treatment plan for them that's going to best suit their needs.
So what does that first appointment, like that first meeting, look like? I mean, obviously the person's coming in with an issue, you're going to want to assess it. So what is that kind of, if maybe Kennedy, if you could give a little bit of a run through how that looks.
Yeah, definitely. So we try to review that intake form before we even go in and meet with the patient so that we have a better idea as to what that patient's coming in for. There are questions on that form that ask about their past medical history as well as their family history as well. So all of that information is important to see ahead of time so that when we go into the exam room too, to just talk a little bit more about what brings them in, we have a little bit more of a perspective and focus as to what questions to ask that patient to really start to narrow down what could be the cause of their symptoms. And it's important to know their past medical history as well as family past medical history to know if there are anything such as contraindications to care and or things that would slow down the healing time for care for them as well. And then after we go through that little history part of things, I always say too, the history part of it, it's important for myself and Dr. Gibas in the history to get as much information as we can from the patients, but really that history part is important as well for the patient so that they too can start to really build some trust in us as doctors and feel comfortable sharing things with us as well, because you'd be surprised at what people tell us.
We are therapists as well, just so you know.
Yeah.
It's really important because I see so many times that people don't always get enough time spent when they're going in to see their doctors. And
Oh
so I
God,
think
no.
that
Yeah.
really special about what we do is we get to, even if we are not giving that patient answers or telling them what to do in order to help their symptoms in that period of time, they feel a lot of relief just because they've been able to share their story. So that's a really special part about that interview process. And then after that, yeah, we go through a little physical exam part so that we can see, we look at ranges of motion. We look at if there's any orthopedic exams that we could actually recreate that patient's pain is something that we look for. And something else that I think is interesting that people don't always realize when they come to a chiropractic office. If someone's coming to me with low back pain, I'm not just looking at low back and seeing what can I find in their low back. I'm really looking from head to toe because we are fully connected from head to toe. So I want to make sure that there's not something in that chain that could be causing low back pain outside of the low back. And 9 times out of 10, there is something outside of that low back or that area of pain that really could be either continuing to cause their pain or is the actual root cause of their pain.
So you're almost like an investigator. You're seeing what's going on, like a little run
Yeah.
through, and then you're trying to figure out, is there, like, what kind of things would be an underlying thing, just as an example, so that they come in with one thing, but maybe it's something else. Do you have any stories or something or anything that you can
Yeah.
share?
Yeah, really quick before I go into a story. If I wasn't going to be a chiropractor, I was going to be a CSI agent.
There you go. There you go.
Now I got the best of both worlds.
Yes, you do.
But yeah, I have a story. A patient of mine recently had a car accident. My aunt had actually been seeing him for years. However, he recently had a car accident. He was in a lot of pain from that, so I sent him out to go get X-rays. And the X-rays were of his cervical spine, and he had little changes in the artery actually. So that was like an example of something that wasn't thankfully the cause of his pain. That was something that had been developing for some time, but that's just an example of one of the things that can be like spotted through doing additional imaging or really trying to find out what else is happening in this patient's body. Because even though there were some changes happening in that artery there, that tells me that there's something cardiovascular wise happening in that patient's body that needs a little bit more attention. So we referred him out to his cardiologist so that the cardiologist can actually work with him a little bit more internally, make sure that like immediate care for his cardiovascular system can be at its highest efficiency and as much health as he can be from that perspective. And then we just make sure what we do best, we can help him in that way.
It's got to be so rewarding knowing that you were playing investigator, and all of a sudden you were able to hopefully help this person and maybe even save them, save their lives. It could have been a lot worse, but with
Right.
with your expertise, I think that's got to be something that you walk away and you're like, yes, I did. It's such a rewarding job that you're doing.
It is. And not to interrupt, but one of the just something that happened recently, similar to like what Dr. Pierce was describing. I had a patient come in, we did x-rays of her neck, and she had something showing up on her thyroid. So of course I was like, have you ever been diagnosed with anything with your thyroid or whatever? And these aren't things we were like, oh, we're looking for that. But it came back that I sent her to see her doctor, and they sent her for an ultrasound. And thankfully, it's just a calcification that they're watching. But it's one of those things that had she not come in for the neck pain and maybe just had that beginning stages of those things, I think it's really important to address that we're not only just like spinally looking, but we're looking at the whole thing as a whole, and why this patient also could be having, these symptoms that are, underneath the surface. So.
Wow. So now we've talked about your investigators, and then so you find out what's going on with a person. It doesn't stop there. They're going to have to do, what is that like treatment period look like? And what do you do? Like if you find something wrong, what kind of things do you do to bring that patient whole again?
Mm-hmm. So, I mean, first and foremost, like most, early in my practice, a lot of chiropractic offices were kind of well known for like, the cookie cutter treatment plan kind of thing. And over the years, I've kind of evolved. I mean, everybody is different age. Everybody's had different traumas in their life. Everybody's had different things. So every patient does not get the same treatment protocol. We try to customize it to what their needs are, whether it's just chiropractic, if we need to do, massage therapy, any other therapies, physical therapy, possibly acupuncture. So everybody's treatment plan is a little bit different. And so, I hope that people understand, because I think that we got a bad name for that. Like everybody gets 15, 3 times a week for this many weeks and whatever, but everybody does get a treatment plan that is really specific to them. And, I will say that some people will come in with this preconception of like, I have to come in, they'll literally ask me, do I have to come into chiropractic for the rest of my life? Well, I'm like, well, if you want to keep moving and grooving, that's definitely what you're going to have to do. It might not be as often, but the goal is to move them from different phases of pain care to corrective care and then wellness care.
So what does what does that look like? I mean, for like if you're doing something for wellness care, I mean, do you have different exercises? What is that plan? Maybe what does it consist of?
Yeah. This is why we made the yoga studio.
Everybody get to yoga.
That's kind of it really is. That was one of the things that, it's really important. If you don't move your body, you're going to lose what your body is able to do. And so when we get patients from that pain state to now building that better foundation, as that patient is now graduating almost to having that maintenance phase of care, sometimes patients, this truly, it varies from patient to patient. There are some patients who feel best getting an adjustment once a month, and that's how they feel they are moving in the right direction. They're taking care of their body on a regular basis. And then there are other people who maybe don't need to be seen for a couple of months, or maybe once a year or twice a year, something like that. So and that's dependent on that patient's, again, age, past history, their symptoms, things such as that. But really and truly, if that's kind of where we said, all right, what can we do to help keep this patient moving their body in the best way possible, in a mindful way, and a way that's not harming their joints.
Yeah. Yes.
So that's where we came up with yoga. So that's really where, when people are graduating to that maintenance phase, we're really encouraging them to maybe it's our yoga studio, maybe it's another yoga studio down the street, or maybe it's like a CrossFit gym or the Lifetime Fitness down the street. But really something like that is what maintenance phase looks like for patients, keeping their body moving.
You don't realize once you go out and you're working out and you're exercising and you're toning, that's what you're doing. You're building your muscles and you're toning. And then this has happened to me, is like you don't get out there, like life gets in the way, you forget to go work out, you haven't done it for a week or 2 weeks, and you really feel it in your body. I mean, and it's important. I've always and you can tell what is the thing, having a good core. That, I mean, tell us a little about, I mean, that's important, isn't it?
Yeah. Having a good core is very, very important. That's kind of one of the things that I absolutely love teaching people about, because I know myself, the way that I was taught, the best way to build your core strength is to do crunches and sit-ups and to suck your belly button in, which is destroying your core. So really and truly, I like to work a lot with diaphragm breathing to help actually depressurize our spine, but to increase pressure of our abdominal cavity. And that's kind of the way that I like to approach core, which goes really well hand in hand with the yoga side of things. And so that's core is important.
It is. I have a question here. Let's see. We've got one of our guests, or our viewers has a question. It says, would surgery in some cases be more beneficial than being adjusted for the rest of your life? And that's Andre Lenartowski. Andre, thank you for chiming in. And do one of you want to take this?
Sure. Yeah.
I'll answer that. So obviously, we know that we cannot, fix every patient that walks in the office. I think surgery should be their absolute last choice. And we do everything we possibly can to prevent them. Now, that patient may come in, let's say they have a disc herniation at the lumbar spine, and we can get them to pain-free, or, their pain level is really tolerable for, 5-10 years. The longer that you wait to have a surgical procedure, the better outcome you're probably going to have, unless there's some neurological deficit issues that we really need to tackle immediately. So, I mean, yes, it can be as surgery can be a good outcome if it's something that is absolutely the last result, and that's, with that nerve pressure and things like that. But at the same time, we've seen patients that come in, they've gotten, we need to have surgery done, blah, 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 and we can help them, with the core strengthening, doing decompression of the spine or wherever area of the spine is, problematic for them. So yes, I do think that, we can help in both ways. So
I'd like to kind of just add to that too, because I do think a lot of times surgery can be something that really is beneficial to that patient, depending on what their symptoms are, what their trauma has been. But sometimes too, I think what people aren't often fully understanding when they're getting surgery, and this could be like dependent on what type of surgery that they are actually getting. But a lot of times we see people who have had actual spinal fusion. And I wish they would come to see us first before instead of after their surgery. Because what actually will end up happening is, if you are getting fusion of your spine, you're taking that disc out, and you're putting basically rods or metal into your spine at that point, and you're fusing two of your vertebrae together. So when you're doing something like that, yes, that might help to depressurize or relieve your nerve at that level. But what actually ends up happening over time is the levels that are above and below where you had your surgery are now taking a lot more stress than they were previously. So what will tend to happen is people will actually start to experience new symptoms related to those above and below levels due to that lack of movement now because of the surgery.
Yeah. And also keep in mind that, and I'm not saying that all surgeries are bad. Some people will come in after having surgery and still have the same problem. So there's no guarantee on both perspectives, but if it were me and my family members, I highly recommend that they actually try something more conservative. Might be a little aggressive in the beginning, but I feel like it would be the first route of treatment before going and having a procedure done.
That's great information. Chris Black, if I walk for exercise, shall I stretch beforehand? That's
Thanks,
good
Chris.
He's my number one fan, you know.
You can go ahead. Yeah.
Okay. Yeah, I'm a huge fan of stretching. One of the things that I think are really important to note though as well, if you're just doing static stretching, sometimes that's not always super beneficial. So what you can actually do, what I'll encourage patients to do is like maybe towards the end of your walk, maybe elongate your stride a little bit more, kind of step into that, do a little calf stretching as you're walking to help like stretch the calf in that moving stretch, if that makes sense. But stretching period is super, super important. I'm like in my mind right now, I'm thinking of a patient that I just recently saw, who I don't know if she has ever stretched at all in her entire life. And moving her legs feels like she is fighting me the entire time that I'm moving her legs. Even though she tells me that she's very relaxed.
You're just tense. You don't even know you're tense anymore.
Exactly. So I do think it's really important to stretch, whether that be before or after or during, or just really at any point in your day, I think can be really beneficial.
And I have here, Andre's making a comment. Orthos are barbaric. And then, we got another here. Jenny is saying, is it true that being adjusted can help with weight loss? That's interesting. Which one of you want to take that one?
Well, she's drinking. So
She's drinking water.
I'll take a little bit of it, and then she can go ahead
and all right.
Add. When we're doing adjustments, we are giving feedback to your nervous system. So although what we're doing is not necessarily causing you to lose weight, we are helping to regulate your nervous system and how your brain perceives things in your body. And we're also helping to downregulate your sympathetic nervous system and upregulate your parasympathetic, which is they're just two opposite sides of the nervous system, which helps to control how our bodies store fat or store weight in our body, and how we can help to release it. So that's kind of quick and dirty. I don't know if there's anything else.
Yeah, no, I mean, I just think if people understand like the nervous system definitely innervates not only our, joints, bones, and ligaments, it also innervates our organs. So if things are like not working properly, you may have things that are slowing down. And so by manipulation or moving the joints, it actually supplies a better nerve innervation to the organs as well. So
plus with every adjustment, there's a release of endorphins, which means you feel happier.
Yeah.
And so I told this to Don as we were going through our run through here, but I lived in Italy for a few months as an au pair, and I was amazed at how much sugar was eaten, how much carbs were eaten, and everyone looked so healthy. And it's because everyone was so happy eating their food. Even just having those release of hormones too that can support being at that healthier weight as well.
And then we have and Chris, what you gave Chris advice. So he said, awesome advice. Thank you very much. And Jenny said, fantastic info. Thank you so much. Thank you, Jenny, for joining us on this episode of Meet the Expert on the Block. I'm glad you were able to listen in on it. So this is all great information. Now, the real reason too, we want to get a little bit of a takeaway, a little freebie for the people out there, is this. We had put in the, and I think it was actually Kennedy and myself were thinking of something that we could do as a takeaway. So Dr. Gibas, maybe you can just answer the question too. So we were like, so many people throughout their day at their jobs, they're always sitting at their computer all day long. And you can get very tight, by doing that. It could be the job giving you stress, or it's just you sitting in one position for such a long time. But what techniques would you be able to give us on loosening up by the computer?
Yeah, I'll give a quick run through with that. I use something that's called Mackenzie. It was created by a physical therapist, actually, but it's a great way to put a little bit of control back into the patient's hands. And so I absolutely love this. I always recommend this to people, either if they're coming to me with certain pain, or if they're just like neck pain, or if they're if I do know that they work at a desk all day and they're just like, I'm getting a little tight, I always recommend doing this exercise. But I'll give a little background before I show it here too, so that it sticks in your mind a little bit better. If you have a cut at the back of your finger here, right where it bends, and then you just keep bending and bending, bending and bending, it's really going to be hard for that cut to heal, right? So when we're sitting at a computer or a desk all day, what we're doing is we're starting, can you see me? Yeah.
Yeah.
Lean forward here, and you're putting a lot of stress like in this area of your spine here. And so what I always recommend for people to do is move into the opposite direction a little bit. So that would be like you would want to just pull your chin back just a little bit so that you can sit up nice and tall. And then you're going to lift your nose all the way up and back, going as far as you can.
Oh, that felt good.
Yeah. The sweet spot is finding your full range of motion. So I always recommend that people do this for 10 times in a row. And each time you do it, you want to keep finding more and more and more range of motion through your spine there. And even if you're not experiencing pain, I recommend doing this because you are putting a lot of stress on your joints, on your spine, on those muscles when we're working at a computer all day long. You can think of a football player. They have to stretch before, they have to get their body warmed up, stretch before the football game, during the football game, as well as after. And so even if your job is not physical like a football player, you still want to make sure that you are supporting your body in whichever position it has to be in for your work day.
Dr. Gibas, do you have anything to add to that?
I think she did a great job. The only thing the thing that I tell my patients too, because everyone's like, when am I going to be able to do that? And I always tell them, we have electronics, we have our cell phones, we have our computers. Everything is very smart these days. So just set your timer on your phone or your computer every half hour, 45 minutes, whether, you are sitting, you're getting lower back pain, do some stretches, extension type stuff. Like she was talking, same thing, your neck and your lower back have the same type of curve. So when you're sitting and you're going in more flexion than both of those spinal curves, you want to try to improve. And by doing that is by going to the opposite. So, just set the timer. Don't give me any excuses. Just try doing it. I promise you, it'll help to reset everything and give you a little bit better, blood supply into those areas, and you'll hopefully have less pain too.
Well, that's awesome information. I'm hoping that all of our guests, Jenny, Chris, Andre, all of you will take advantage of this little bit of information that was just given to you, so that when you're sitting by your computers, be sure to loosen up. So I want to thank you both for being on this episode of Meet the Expert on the Block. I was getting nervous because I'm like, is Dr. Gibas going to show up? But I'm glad you were able to make it. It's so awesome and such great information.
Thank you.
Thank you. And it doesn't look like anybody else. Check one more time, but it doesn't look. I can't see if anybody left any. Chris said, yes, wonderful presentation. Thank you very much. Yes, and oh my God, look who's here, Laura. Happy birthday.
Happy birthday.
Happy birthday. Yes, thank you for for jumping in. I'm glad that you came and were able to hopefully listen into a good portion of the show that I had today. So I want to thank Dr. Gibas, Dr. Pierce. Thank you so much for joining me on my episode of Meet the Expert on the Block. This was awesome. It was a lot of great information. I'm glad that we were able to get to know you better also. And if you both wouldn't mind, Dr. Gibas has to give the phone number. Dr. Kennedy, you got to give the email address. And if you wouldn't give it, Dr. Gibas, you can go first. And then, Kennedy, if you would please both just phone number and email so people can get a hold of you if they need to.
Absolutely. Call us at 847-426-7008.
And the email address is NBC, as in New Beginnings Chiropractic, NBCHIRO620@gmail.com. Right?
Yes, ma'am.
Well, thanks to everybody that joined us on this episode of Meet the Expert on the Block. And like I said, if you love what you hear with the information that I'm giving out, please follow Dawn Block Realtor. But you can also see me on LinkedIn, Instagram. I'm pretty much everywhere. In our next episode, I got it right here. Let me tell you about it. I'm excited. We're going to have Chuck Tamby from Avion Technologies talk about why we need a website. And that is going to be live at 5 on March 27th. So that's just next week. So I'll look forward to have that. I'm kind of excited to hear all about that. Hopefully he'll give us some good tidbits of information. And until next time, I just want to thank again both of you for being on this show, and I hope everybody has a great rest of your week. Bye-bye.
Thank you so much.
Thank you.
Bye-bye.